The latest outbreak of the measles continues to get worse. That according to the Centers for Disease Control, who now says that 78 new cases have been reported since last week. That pushes the total number this year to more than 700, the highest in a quarter century. Doctors say the increase is tied to a movement against vaccinations that's filled with misinformation. And now physicians fear this measles outbreak is just the beginning.
It's making the community in general on edge. We have this, like I said, this microcosm, this small number of people who are making a lot of noise in terms of to try to get people to at least be on the fence.
22 states have record cases of measles, but the vast majority are centered in New York. Health officials are urging parents to vaccinate their children. If you're not sure if you or your kids have been fully vaccinated, you need to talk to your doctor.
And measles just aren't for kids. The shots aren't. With the virus on the rise now, some adults want to know if they need a booster shot. I sat down with a doctor tonight to learn who's most at risk and who should consider a new dose.
Measles is a virus that invades your whole body.
And cases are on the rise in the U.S.
And it worries me because measles is not a trivial disease.
Dr. Walter Ornstein, Associate Director of the Emory Vaccine Center, says the highly contagious virus can do more harm than form red rashes. It can lead to high fever, ear infection, severe diarrhea, and more.
Pneumonia, brain inflammation or encephalitis, and even worse. And unfortunately, it kills and it can cause brain damage.
That's why he and other experts encourage adults to check their vaccination status.
People born prior to 1957, if they are from the United States, almost all of them have gotten natural infections, so they're not at risk. But people born later who haven't gotten documentation of 2 doses of measles vaccine could be susceptible.
The Centers for Disease Control and Prevention recommends 2 doses of the measles vaccine, citing 2 doses are 97% effective at preventing measles. 1 dose is about 93% effective. The CDC also says adults in settings that pose a high risk for measles transmission should get the recommended 2 doses. Those groups include students at post-high school institutions, healthcare workers, and international travelers. Dr. Ornstein's recommendation, when in doubt, get the vaccine.
If you're already immune, nothing will happen. You will kill the vaccine virus and nothing will happen. But if you're susceptible, you can then get an immune response that will protect you if you are later exposed to the wild measles virus.
Now, the CDC says if you receive 2 doses of measles vaccine as a child, you do not need a booster dose. But if you're not fully sure about your vaccinations, talk with your doctor.
All right, good info, Marissa. Thank you.